Hello and welcome. Thank you for coming here on such short notice. We have our chair, Julia Olson Bozeman, that's going to give a few remarks about the first positive or presumptive positive case of COVID-19 in New Hanover County, and then we will take questions from the media.
Thank you for joining us this evening. Commissioner Rob Zappel is here with me. I received information this afternoon, of a New Hanover County resident who has tested presumptive positive for COVID-19. While this is the first case of COVID-19 in our community, it is something New Hanover County has been preparing to respond to with our state and local partners for several weeks now. Here's what we know at this time. We believe this is an international travel associated case. The person returned to the U.S. on March the 12th and developed very mild symptoms on March the 13th. They returned to the New Hanover County area on March the 15th through ILM Airport, and then followed up with their provider on March the 16th, where they were tested for COVID-19 and placed on home isolation. They received results today, March the 18th, and remain in the home, and they are currently doing well. Contact tracing by public health staff is underway, and if there's any additional information that needs to and can be shared, we will certainly share it. The measures that have already been implemented in our community are even more important now that we now have a presumptive positive case. They're in place to help prevent the spread of this virus. Currently, there have been 65 tests conducted in New Hanover County to date. 20 negatives have been received. 1 is pending at the state lab, and 43 pending through private labs. I encourage our community to please continue to be vigilant, wash your hands, stay home if you are sick, and practice social distancing. Stay 6 feet away from others, don't go out in the crowds, and avoid any gatherings with more than 10 people. We have a public health coronavirus call line set up Monday through Friday from 7:30 a.m. to 6 p.m., and the number is 910-798-6800. Residents can call and ask questions, as well as receive referrals to local physicians, equipped to test for flu and COVID-19 if it is needed. If you have a fever and respiratory symptoms like coughing and shortness of breath and have not had contact with someone who has had COVID-19, the current state protocol for testing involves getting a flu test first. If the flu test comes back negative, then provider may determine if you need a test for COVID-19. New Hanover County will also begin deploying our public health nurses to residents who are pre-screened and referred by our call center and who meet the criteria for testing, beginning on Friday of this week. Our nurses, in a safe manner, will be able to conduct flu testing and then COVID-19 sampling if needed. This is an important way we'll be filling the gap for those without direct access to a healthcare provider. So that the public is aware, anyone who is tested for COVID-19 is instructed to stay home until their test results come back. That is really important to help keep our community safe. That protocol was followed in the first case, and I'm glad. As a reminder, please always call before showing up to any doctor's office or health clinic and share your symptoms with them so that they can determine and prepare accordingly. And do not go to the hospital emergency room unless you have a true emergency. Residents who are 65 years and older are the most at risk of complications from the virus, as well as those with underlying health conditions. So it is incredibly important that we all do everything we can to protect ourselves, our families, and those who are most vulnerable. I know the news today makes this virus more real for all of us, and I know the first instinct is fear. But please remain calm. Continue practicing social distancing, work from home if you are able, and stay informed with trusted resources. The best place for our community to get local and up-to-date information is our website at health.nhcgov.com and also on the county's social media pages. Let's all move forward with the facts, not fear. Support one another and make sure we're listening to the advice of our public health experts. We will now open it up to questions from the media, and I have a few people with me to answer questions. Our Public Health Preparedness Coordinator, Lisa Brown, Personal Health Services Manager, Carla Turner, and Emergency Management Director, Stephen Still.
And just so we can make sure that the community listening and watching on Facebook can hear, if you'll come over and speak into the microphone. If you prefer not to, our chair can repeat your question.
What about people this person was in contact with before they were tested positive? Are they being put in some kind of quarantine?
Lisa?
So this is where the public health, Lisa Brown, Public Health Preparedness Coordinator. This is where the public health contact tracing will come into play. So that will be follow up, identify those that were potential close contacts. Close contacts defined by the CDC is within 6 feet for 10 minutes. And then we'll be following up with those individuals, and they will be asked to self-quarantine at that point if there's anyone that we need to follow up with. And I would say that we wanted to get this information out and make our community aware, so that contact tracing is actively going on right now.
This question comes via Facebook from the Star News. Will the county declare a state of emergency? And then a follow-up, how will you determine who qualifies for home testing?
At this point, no, the county is not going to declare a state of emergency, and that will rely on the input of staff if and when that ever has to happen, which we are certainly hoping that the precautions that we've put in place and encourage everyone to continue to use with the social distancing will prevent us from having to do that. So we're very proud of how the public has responded. You know, special thanks to the restaurants who are helping the kids with the school lunches, to all the people who are helping feed, and just I ask people to please support your local businesses when you can, because these people have done a lot for our community in times of hurricane and provided food when we needed their help, and now they need ours. Carla. Sorry.
Carla Turner, Personal Health Services Manager, New Hanover County Public Health. For those who are, what we will do, as we've been doing for the last few days, citizens can call our call center at 910-798-6800. We will ask them a series of questions and determine if we need to send their information up to our community health team, who will contact them, fully vet them, ask some more specific questions, and if they are determined to be appropriate for testing, we will then have our mobile teams contact them and be ready to go out and do a home visit. Again, if they have private insurance and a primary care provider, we're going to refer them to their care provider. We are going to focus on the uninsured and those with no access to health care.
And this question's from Port City Daily. Forgive me if you've already answered it. Can you elaborate on the 40 tests that were conducted? How long did it take to get tested, and when we can expect results?
Lisa, I thought you were going to.
So that really depends on when the test was conducted and to which lab it was submitted. So we've heard of very fast turnaround times within 2 days, but some have taken longer, more along the lines of 5.
Are there any other questions?
Thank you, everyone. And just Commissioner Zappel said, we're still under the executive order from the governor's office. So we encourage everyone to abide by that order and stay safe and take care of each other. Thank you all.